I feel very, very happy that we are on the winning path. But we must not be complacent. There are three major lessons that we've learned in the course of this fight. Three issues that we must attend to. The first one, of course, is that science must be at the base, must continue to be at the base of our decision-making. We must encourage research, biomedical research, as well as research that involves various other disciplines. And I want us to be creative, to be innovative. I sometimes sit and dream when I read about these unmanned drones that are being used in bombing, in warfare now, that if I could get some of those engineers to work with the medical entomologists, they would then design little drones that would swarm around like locusts and chase Anopheles mosquito, black flies, and so on. We can leave the battle to them. Nobody would argue if we had little drones chasing mosquitoes to control malaria. I dream many, many other absurd ideas, but my friends get worried when I come out with these ideas. So I will not explore them. But we can win, but we must bring all the sciences together to deal with it. The second issue is collaboration among all the stakeholders. We've learned that public-private partnerships are very, very, very successful and help to move towards victory. When I entered WHO in 1976, the temper in the world at that time was against the drug industry. They were regarded as being selfish and interested only in the profits they can make. So that we finished up having to insult them by day and crawl to them at night to look for remedies that they and they only could produce. But the picture has now changed. At the London meeting in January last year, which was supported by Bill Gates, 13 pharmaceutical companies were there, and they all signed on the dotted line that they would join in this fight against the diseases that we call neglected diseases. So we must make sure that all the obstacles that make it difficult for people to collaborate on disease control will be removed. The third issue is our relationship with communities. We have in the past tended to regard communities as passive recipients of our vaccination programs or mass drug administration and so on, with very little involvement, true involvement on their part. We must change that. We must have them full partners to participate at every stage, planning, distribution, evaluation, and so on. A recent example is the development of community-directed treatment with ivermectin, which empowered communities to make all the plans and be involved in the distribution of ivermectin for onchocerciasis. And the result has been marvelous. It's been so good that it's been applied for the distribution of other interventions, for bed nets, for vitamin A, and for other things of that sort. We must, in fact, treat the lay public as full partners. In some respects, some of the problems we've had with the control of polio in Nigeria and elsewhere were not due to biomedical problems. They were due to the friction and the misunderstanding between the health system and the community served. We must now seek the help of social scientists, we must seek the help of anthropologists and others who would help to seal the bond between the doctors, nurses, and other health workers, and the communities which they serve. It remains now for me to go back to where I started. I really wish to thank President Jimmy Carter and Mrs. Rosalind Carter for being my mentors. They allowed me to come close enough to observe their legendary work in humanitarian relief throughout the world on many aspects, health, elections, and so on. I also wish to thank my family, who are well represented here. My wife is here. 2 of our children are here, and 2 grandsons are here. My cousin, Professor Abasego, and various other friends, Sir George Alain, Dr. Adeyi, and many others whom I will not be able to mention. In addition, those who could not be here, who have sent messages, who are here with us in spirit, I wish to thank all of them indeed. And finally, I wish to thank and congratulate the National Foundation for Infectious Diseases, A, for honoring me, and B, more importantly, for their leadership in the fight against infectious diseases. We are winning. Thank you.
Ladies and gentlemen, please join me in recognizing our honorees one more time. And finally, as Pat Joseph has already done, but I would also like to recognize one more time our leader, our executive director, Len, who Pat mentioned will be retiring later this year. But in my mind, Len, you are a hero as well. And it is because of you that we've really gone to 40 years as successfully as we have. Literally, you've led us for half that time. As Bill has been maybe the face and the voice, you have truly been the soul of our organization, and we're all grateful for that. And thank you very much, and we certainly expect to see you in the future, and we hope to benefit, we expect to benefit actually from your wisdom and counsel in the future as a consultant. So thank you very much again, Lynn. So ladies and gentlemen, that concludes the festivities this evening. We hope you certainly enjoyed them. I certainly found them very inspiring, and we hope to see you again next year. We appreciate your support, and please be safe as you go home this evening. Thank you very much.
Trumpet man from out Chicago way. He had a boogie style that no one else could play. He was the top man at his craft. And then his number came up and he was going to draft. He's in the army now and blowing reveille. He's the boogie woogie bugle boy of Company B.